Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Eric. It's on. Okay, Eric, tell me what's going on with your neck, what happened?
So basically, I'm having a lot of tightness in my traps and my neck. Whenever I flex my head back and forth, or in the mornings when I turn side to side, I just feel a lot of general tightness from built up, scar tissue over the years.
How long has this been going on?
This has been going on for probably almost a year now in the neck.
A year, okay. How did you hurt your neck?
The neck, I'm not sure, either from exercising at the gym, doing too many shrugs, or sleep posture, or something, I don't know.
How much pain do you feel in there at worst from 0 to 10?
At worst, an 8, probably an 8, early in the morning.
Where do you feel it exactly?
Right in the middle here.
In here?
And then down on the side of the trap.
So both of them?
Yeah.
Oh, you have a lot of scar tissue here. And what kind of treatment do you have for your neck? Because you've had it for a year, yeah?
Yeah, I've been to chiropractors to have adjustments. I've had massages.
Okay.
I've actually tried that. They call it Graston.
Graston?
Yeah, I've tried that. I feel like that does more pain than fixing anything.
You start to have bruising and stuff like that.
Yeah, and they tell you it's just the blood, I guess, coming to the top. I didn't never really bruise. It just got really red.
Red.
Like a rash.
And you felt sore for a couple of days.
Oh yeah.
Yeah, well, the problem that, they're still teaching that in their courses, that the normal healing cycle, the body has to go through inflammation, proliferation, and maturation. So they believe and they teach the doctors that they want, like patient when they have a scar tissue, they usually in the proliferation stage, they believe they want to stimulate inflammation again. So you're going upward. Do you guarantee the new inflammation gonna build less scar tissue than the old scar tissue?
Well, you don't know.
Only God knows.
Yeah.
So it's actually, I don't know how you heal if you cause more scar tissue. That's a bad methodology. And the other problem is the design of the instrument is actually causing trauma. So if you cause more inflammation, that's going to cause more scar tissue.
I'm just going to keep building and building.
It's a vicious cycle, actually, the instrument creating that.
Yeah, because the day of, it feels fine, afterwards. And then, it just comes right back. Nothing kind of fixes the problem.
Yeah. So you had Graston, you had chiropractor, you had massage, what else?
I've had, one of the chiropractors did the ART, the active release.
Active release, okay.
That seemed to help the most, because he's actually, working the muscle and then with the movement.
Yeah. But you're still feeling pain?
Yeah.
Okay, so it was temporary?
Temporary, yeah.
Okay. What else you had?
That's pretty much it, and other, heating and ice.
Okay, that's a temporary pain relief.
Yeah.
Okay. So let's do your range of motion. I want you to remember how far you can look to the left and right so you can compare it afterwards.
Okay.
And let me know how much pain with that.
Right now?
Yeah.
Okay.
So turn left and right. It's a little bit tight here.
Yeah.
There's more range of motion this side. Can you tell the difference? Yeah, you're just really a little bit limited here. Let's go backward.
Yeah,
that's
see
not
right there,
bad, actually.
It's tight already here.
It's more on the right?
No, right in the middle is just, tight.
Okay, so do you feel more tightness in the right trap or left trap?
When I turn this way, it's about even. Yeah, it's about even tightness.
Okay, what about side bend, left and right?
Yeah, I feel tightness in the middle, right in the middle when I do it this way. I feel it right in the middle, the tightness.
How much from 0 to 10?
It's probably a 6 right now.
Okay. All right. So, anything else I need to know about this condition? Any other treatment or?
No.
Okay.
I haven't had any surgeries or anything like that.
Okay.
Just
Graston active release.
Yeah, massage, chiropractor.
Okay. Make sure what I'm doing is not painful. Okay, so this is a knot you're talking about. Man, you feel this one?
Mm-hmm.
That's a very thick one. Feel that? Okay. Let me know if it's too much, okay?
Okay.
It's okay to take your shirt off?
Yeah.
Okay.
It's probably easier, huh?
Yeah, it's easier, so we'll get there. Okay. So you do a lot of workouts?
Well, I was until I started getting all this neck pain, and
Mm-hmm.
now I kind of cut back on it
Okay.
because it feels like when I do like back or chest workouts,
Mhm.
it aggravates and it hurts more.
So you feel it like a band here, or
Yeah.
you feel it like a knot? What do you feel?
It feels like right in here. It just feels like
Two knots.
two knots. Yeah.
I can feel it here. It's
Uh-huh.
very, very full, and you can see my finger here. Can you see it? Like this is bouncy. This is like hard feeling. I don't know if you can feel it in the camera. Yes. Okay. That's a correct answer. Okay. And that pulling on your head on the top here, yeah?
Yeah.
Okay. Let me get. You can go back a little bit. Let me know if it's too much, okay?
No, it's okay.
How does it feel?
It's tender.
Make sure it's not painful what I'm doing.
No, it's not painful.
Okay. So I'm trying to release the deep tightness that you have there. Feel this one here?
Mm.
How's that?
Yeah, there's no pain. I just
Mm-hmm.
I could feel the knot as you're working.
Mm-hmm. Do you get headaches?
Yeah, every once in a while I'll get a headache, but nothing too severe.
Where do you feel it?
Most of the time I feel it kind of like in the back, and then like down here.
Okay. Do you have a headache today?
No headache today.
Okay. Okay, I'm gonna get the other instrument. The one is small a little bit. So. Anything down to your shoulder, or just the traps?
No, just mainly the traps and the neck area.
Okay. Feel this bump here?
Mm-hmm.
That's a scar tissue here.
Mm. I know I have another one like right in here somewhere too. It feels like a lump.
Yes, yeah. Mm-hmm.
I figured that was probably like a
Mm-hmm.
tight band or scar tissue as well.
The band is usually the fascia restriction, and I can feel it. It's tight in both sides, but it's more tighter here.
Yeah, the left.
Can you tell the difference?
Yeah, the left side
Yes.
is more tight.
So I'm actually moving my hands on both sides here, and I feel there is more give here
Mm-hmm.
on the right side, and here it's like more like a band, like pushing upward this way.
Yeah.
Here, there's a lot of scar tissue here. You slouch forward a lot? We're sitting in the front of the computer. There's a lot of scar tissue here. It's like a layer of scar tissue.
That and when I played football, maybe from the helmet.
Oh, okay. It's a lot of scar tissue here. Feel that?
Yeah, yeah.
And you can see the tool is like jumping.
Jumping, yeah.
Jumping, like here, yeah. It's like you have a line of scar tissue here.
Yeah, that's right where my helmet, like the pads inside would sit.
Wow. So a lot of scar tissue.
You don't realize what the high school sports are doing to you till you get older in life.
Well, especially if you do you play a lot, If the helmet is really tight on your head, not a good fit, you're gonna have a lot of issue. It was tight on you?
Yeah.
That's what I noticed. Because you should not have this from the helmet if it's not tight. Okay. You still have the same helmet?
No.
Okay. Don't use it.
That's long gone.
Yeah. Yeah. Make sure this is not sore what I'm doing, okay?
No.
So you had Graston before. Can you tell a difference between those tools and Graston?
Yeah, Graston I would already be grabbing onto the chair.
Okay. I'm glad we're not taking that on video.
Yeah.
Yeah, so it's painful, yeah?
Yeah.
Okay. Okay, I'm gonna come back to this, okay? I'm gonna get some lotion.
Okay.
You're gonna feel cold, okay?
Okay.
You're gonna get some redness from scar tissue here.
Yeah.
But we don't believe in causing inflammation like what they teach in Graston.
Okay.
So the redness should disappear in 10-15 minutes, okay?
Okay.
As long as you give me a feedback if I'm rough with you, okay?
Okay. So all these little like bumps that I feel when you go over, that's like scar tissue, huh?
That's correct. Okay. If you feel it's nice and smooth like this, that's not a scar tissue.
Right.
Feel those? That's a scar tissue here.
I feel a lot over there.
In here and a little bit here, So a little bit here. Head opposite. So you feel that here inside. Do you feel that too? Correct. The correct answer is yes.
Yes.
There you go. Now you know the answer for all the questions. Okay. So we're gonna do this side. That's a big one here. That's a sticking out to the point you can see visually the scars out. This is the thickness of the scar. Can you see it? This bump. That's the scar tissue deep in the trap and it's actually coming out. You can visually see it. Can you feel it?
Oh yeah.
So usually when it's in here like that, that's taking the thickness of your muscle. You said you've been doing a lot of shoulder shrugs?
Yeah.
I think that's
not just a lot, but also, heavy weight as well.
Yeah, I think I will put hold on the shoulder shrugs. You don't need that. You don't need to strengthen your traps.
That's one of my main
workout
problems. Well, not workout, but problem is because it's like an ego thing. You go into the gym and
you're like, how much you lift?
Yeah, how much can I lift today?
Which guy was like, I know I used to think this way. It's actually, you probably overtrain with this.
Yeah,
that's a big scar tissue here. So let me. This is going to take us a few sessions actually to totally break it.
Oh,
but you can see, can you feel it here? There's not bouncy here. My finger's going in here. Finger's not going, just stuck. It's a big knot here. Okay, let me actually clean this up. and we'll get the front view because we're gonna do the range of motion again. I want you to tell me how you feel.
Okay.
Okay. So it was how much? 6-7 before we started?
Yeah.
Neck. Okay, so I want you to turn left and right and tell me how far can you see? Can you see a difference?
Oh yeah, I could feel already this is a little bit more, yeah.
You're going further here. And that's much further.
Yeah, before I would stop here.
That's your norm, by the way.
Huh?
This is a max.
This is the max?
That's probably the max.
Oh, okay.
Here it's a little bit tight. No, you go in there. Okay. What about extension? Because you used to feel it in extension. How's that?
Yeah, it feels a lot better. This feels looser now, but now when I do this, I feel like it's pulling here.
I know we're gonna do this. Okay.
The back feels good though now.
Okay. So you feel it in the neck here. Both.
Yeah, so when I go up, yeah.
Yeah, I usually do this lying down, but we don't have a lot of room. So I'm gonna try to do it here. Here in the front.
Mm-hmm.
In here or in here?
More, yeah, like in the front here.
In the front here, okay. Alright, so, what do we do? Man, you're tight.
Yeah.
Okay.
This is what happens when you just
I'm
deal with
gonna give you an injection. Okay, close your eyes.
Alright.
Not really. We're just gonna release some areas here. Is that too much?
No.
Okay. You slouch a lot.
Yeah, because I sit in front of a computer for most of the day, and then after a while I tend to start slouching forward.
Slouching forward, okay.
And then you go home, and then you're looking at the phone, and you're slouching again.
Everything is forward.
Yeah. I've thought about getting one of those, what are they called, the posture shirts or whatever, to kind of help train you to keep your shoulders back. And you think that would be a good idea, or?
Well, here's the problem I have with this. You're gonna depend on it. You're not gonna work your muscle.
Yeah, right.
You're not gonna wear that all day long.
Yeah, right.
And it's very hard to wear it in the summer.
Yeah.
Don't wear that in 100 degrees. I believe that you should work your muscle to do that, so you don't think about it.
Right.
Automatic. We're gonna do some core stabilization.
Okay.
To turn on these muscles. The goal is actually to change this habit from here to here, so we have to have a lot of neuromuscular re-education by feedback. But if you comply with the program, it usually take 2 to 3 weeks to actually correct it.
Okay.
If you obsess about it.
Yeah.
You know?
Well, I mean, I've been dealing with this for a year, so.
What takes time is actually not releasing the scar tissue or the restriction or the pain. It takes time to change a lot of habit we used to do.
Right.
Because we have to strengthen the muscles. So as long as you follow your home exercise program, you should your posture should be improved.
Okay.
Okay, so you're gonna feel cold. You feel that here?
Mm-hmm.
It's not too much again. You hear that?
Oh yeah,
here?
yeah.
Okay. You got a lot of scar tissue here, and you can see it a little bit red here.
Yeah, that's from all the chest workouts.
Yeah, you got a lot of chest workouts.
Everything you work out, as you tear the muscle.
If you overdo it, you have a lot of scar tissue.
Right.
If you overtrain.
Yeah.
Yeah, you see how there's a lot of scar. Tightness or not.
Okay.
Okay, so up and down. How's that?
Oh no, it's gone.
Mm-hmm. Turn left and right, your head.
Yeah, see, because before when I went like this, I felt it pulling here.
You're pulling this way. Okay, you don't feel that pulling now.
No.
Mm-hmm. What about turning left and right?
No, I don't feel no restriction or tightness now.
Mm-hmm. Any pain?
No pain.
All right, awesome. So what you had before chiropractor, massage,
yeah, everything.
Graston and ART. So what do you think, having ASTR treatment and having that before? What's your experience?
Well, I think definitely with this, I could feel you when you're going over the scar tissue, right? I could feel where the adhesions are.
Mm-hmm.
Whereas with the Graston, I'm more of in pain. I don't really feel
it. You don't feel it.
I'm more of trying to not feel pain. You know, I'm trying to like fight it.
Yeah.
Where this, you know, I could feel the spots that, you know, like you're saying, there's a lot of scar tissue, especially in here, you know, with the chest workouts and everything, and obviously in the shoulders. Mm-hmm. But, you know, a couple of times after you went over it, I felt it got smoother. Mm-hmm. I don't feel that with the Graston. The Graston, I feel more pain in it than anything. Mm-hmm. Awesome. But this is much better.
Mm-hmm. Beautiful. Awesome. Thank you so much.
Yeah, no, thank you.
Yeah, thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.